Welcome back to Mapping Healthcare on KDRT 95.7 FM in Davis, California, where a medic with a map explores healthcare around the world, highlights people who improve it, and shares what we can learn from them. This is your host, Dr. Sheikh. Picture this scene. Millions of people getting essential hands-on care every single day. We're not talking about bustling hospitals, nursing homes, or clinics, but the quiet, often very private space of someone's home. Home care, it's that foundational support that lets people with illnesses or disabilities live where they feel most comfortable, at home. And it's a whole world of care delivered by home health workers, a workforce that's absolutely vital to our healthcare systems, but one that often operates in the shadows, which is where we're headed to in today's episode of Mapping Healthcare. We're going to understand who these home health workers are, what are the vital tasks they perform, and the many challenges they face, the things that make their work feel invisible or undervalued, and we will also explore ways to better support them and, by extension, the people they care for. Let's think about the sheer scale of this workforce first. Home health, home care, and personal care aides provide most of the paid hands-on care that happens outside of hospitals and nursing homes. And the numbers are huge. There are over 2 million paid aides just in the United States alone, and their demand is projected to grow significantly. So that's a massive growing workforce. Let's look at their core responsibilities. Some of their tasks are very hands-on, helping with personal care, things like eating, bathing, dressing, toileting. They also assist with what are called instrumental activities of daily living. Housekeeping, preparing meals, laundry, basically helping people function as well as possible in their own homes. But their role goes way beyond just those physical tasks. Home care workers aren't just task doers. They are, in so many ways, our eyes and ears on the ground. So what are they seeing that maybe others might miss? Because they spend so much time in the home of the person they're caring for, they're uniquely positioned to notice critical details, things that can be vital for timely clinical decisions. Subtle changes in the patient's medical condition or their functional ability. They also see the home environment itself. Where are the fall hazards? What's actually in the fridge or the medicine cabinet? Practical things that someone visiting the home for a few minutes wouldn't necessarily notice. They see the degree of social isolation someone might be experiencing, potential signs of depression, and complex family dynamics. This kind of real-time ground-level information is critical for doctors, nurses, and social workers to know. So they're providing this vital surveillance, this crucial context, often without it even being part of the job description. For many patients dealing with serious illness, home care workers become a source of connection and emotional support. They also often have the most interaction with family members. If someone sees a lot of different doctors and moves between a hospital and home care setting frequently, home care workers provide that essential thread of connection. This is complex work. It requires skills, multitasking, quick decisions, and often they're doing it with very little supervision. But despite their critical role, home care workers face many challenges and a persistent feeling of being invisible and undervalued. They're still sometimes referred to as unskilled, which feels like such a deep contradiction given all that they do. We see that reflected in low wages and often inadequate benefits. Some of this stems from a lack of awareness and understanding, not just from the public, but sometimes even within clinical teams and among policymakers about the complex tasks these workers actually perform day to day. That lack of awareness means that their contributions aren't fully appreciated. A study on New York City's home care workers during COVID-19 showed that they were on the absolute front lines caring for the most vulnerable people, yet so many felt forgotten compared to, say, hospital staff who got much more public recognition and support. There's also a heavy emotional and physical toll on home care workers. They're dealing with illness and death regularly. They can feel solely responsible for a patient's well being, and they sometimes have to navigate really difficult conflicts with family members. That's a lot of pressure, especially if you feel like you're managing it all alone. Family members often describe home care workers as a blessing. They provide families with much needed respite, enable them to manage their own lives, keep working, and avoid the burnout that can come with caring for a family member full time. So, how do we support home care workers? Standardized training, addressing psychological, social, and communication issues and boundary setting, building assistance and support networks, places where workers can talk, share experiences, combat professional isolation, and process difficult situations or burnout. And on the policy side, designating home care workers as essential workers could give them necessary benefits like paid sick leave, access to childcare, and personal protective equipment. Our guest in today's episode of Mapping Healthcare is Chika Odioemene, and we talk about her experience in training and supporting home care workers in Nigeria. The views expressed on the show are mine and those of my guests. Chika is a registered nurse and nurse practitioner by background and is the CEO of Utopian Healthcare, a training institute for home caregivers in Nigeria. So, Chika, Nigeria, just like the United States, faces a shortage of healthcare workers. And the premise of your work is that empowering caregivers at home is one solution to tackle healthcare workforce shortages in Nigeria. So tell us about how these caregivers support healthcare professionals and help alleviate this healthcare workforce shortage in Nigeria.
Think about it, we celebrate high-tech surgeries, right? But we forget who holds the patients once they go home, right? And for that high-tech surgery to really be successful all the way, it demands that healing time where the surgeon and the nurses and the OR specialists aren't there, right? So imagine a patient freshly discharged from surgery. The surgical team did their part, their best. But the follow-up depends on who is watching the wound at home, right? Who is checking for infection, who is making sure the patient eats and moves and heals. So our caregivers do exactly that. They support activities of daily living, bathing, grooming, feeding, mobility. They support with chronic management, checking the blood sugar, blood pressure, medication reminders, for post-operative care. If they see something that they know what to look out for, they are not doing the wound dressing for post-op surgical things, but they know that shouldn't look this way, right? Fall prevention. So they are trained to recognize red flags and escalate to a nurse or doctor. And to me, that's the most important component of it, is recognizing that somebody needs to know this rather than waiting when it's too late. So we teach them things like, hey, if it's post-op, look out for signs of shortness of breath, just the things that you will normally, even during that phase when they're home. And modern tasks, they provide presence, if you will. It's like the bridge between the clinical system and the patient's everyday reality. When I'm in the hospital, I can't imagine the realities the patients face at home post-discharge. But I want to talk about another role that we found for our caregivers outside of the home. Once we train, we actually conduct a community outreach, and we take our newly graduates, we take them out in the community, sometimes even after they've validated the skills to check blood pressure and check blood sugar. We take them out in the community, and we have this community outreach program called ABCDE program, where we're asking people about their A1C, your blood pressure, cholesterol, diet habits, and exercise. So the nurses go with them and they focus on community health education. But our caregivers that are now skilled to check blood pressure and check, they are conducting this. It's such a win-win situation because they're happy to contribute to the community, and they're finding people just walking with really hypertension, unaware. Some people are aware, but just poorly managed. We've seen children with a really high blood sugar just randomly. I mean, this happens, the stories go on and on. So it's not just even the home care, and this wasn't part of our design, but we ended up there, and I'm really glad we did.
So let's talk about the specifics of this training. So, you run Utopian Healthcare, a training institute for home caregivers in Nigeria. And through this organization, you've trained over 1,200 caregivers so far there. This seems like a really comprehensive set of skills that these individuals leave with when they finish your training. So let's talk a little bit about your specific training program setup. So, who are the typical people who sign up to attend? How do people apply? How do people get in? Do they leave with some sort of a certification? So, just like sort of the structure of this training.
So we have a 3-week program. It's intensive. It's 150 contact hours. And it's designed to be immersive, accessible, grounded in real life. So a lot of people have asked us about, can we do it online? I'm like, you can't learn hand hygiene online. You can't learn how to wash your hand online. We need to see that you could do it. But we're still working on it with doctors and nurses. So you will certainly need to come in and show us that you could do this well. So we cover about 12 modules from vital signs, infection control, and everything is focused on the caregiver's role. Nothing outside of that role, even in taking care of children, recognizing the developmental stages in case they are called upon to take care of children, chronic illness, also recognizing things to escalate, mobility, end of life support, effective documentation, and just understanding how important their role would be in any client's life. All our instructors are led by nurses, and we call them CNE, but they are all registered nurses. What sets up apart is our deep emphasis on what caregivers can do and what they cannot do. And it's so important for us to do that because we're really grounded on safety. And in a country where the boundaries can easily be blurred, even when they do internship, there's a document, we go to the hospital and say, these are the things they cannot do. So we screen applicants not just for availability, but for attitude and teachability. So in Nigeria, I can't account for how many languages we have, but not everyone would speak English and not everyone would have had high school education. But because we teach in English, we will have to make sure that you understand what we're teaching. So we do have some screening process. There's a bit of a language issue. We would test for that. But my hope is as we expand, we start to offer these courses in different languages because language does not stop the care. So we just need to be able to adapt to that. And many move into internships. We've had partnerships with a lot of hospitals around our locations that will accept our caregivers to continue the real life experience with the internship program. And once they're in the home care, they're never left alone. They're assigned to a nurse. Because remember, caregivers cannot do an assessment and make use of that asset. And nurse have to do the assessment and then give the caregiver the plan of care actions to carry out.
The caregivers that you train leave with a comprehensive set of skills, and clearly these are such valued people. And we've been seeing, even with clinicians, right, like nurses and physicians, we've been seeing a tremendous amount of stress, burnout, people leaving these professions early. And I can imagine some of these home caregivers running into similar issues as well. So when these caregivers begin working, what sort of support do they need to continue doing a good job? Do they run into issues around workplace safety, given that essentially their workplace is other people's homes? So, not as regulated as a hospital or clinic where other kinds of health professionals work. I can also see how such a job could be really stressful and take a toll on the home caregiver. So, what sorts of issues do you see come up, and how could people support these really essential workers?
Let me just add another layer to that question. There's a common practice in Nigeria that people, and it's not my favorite term, but people hire domestic workers to work in a home. And essentially, they live in the home, and some of them go and come back. But for the traditional method had been they live in a home to take care of, go to the market, clean up the home and whatnot. So even when they're hiring caregiver, there's a confusion about domestic work and being someone who is here to focus on health related component. So just everything else you've said, just having the home is unregulated because you're now in a home. You have to adapt to the home's culture, the home environment, the complexities of home. We've had stories of polygamous families. It's pretty interesting. We're all fighting who is in charge here. You're like, okay, we're in the middle. I mean, just all dynamics. And what we've learned is we had to put guardrails around our caregivers to support them. So one of the things we do is we'll make sure that every caregiver is attached to a registered nurse. So they're never alone. There's oversight. We have regular check-ins with the caregivers. In fact, one of our mantra is that a caregiver's mindset will reflect the care they give, right? And it's something we're actually trying to teach even the families because of this domestic practice we have, domestic worker practice, we don't always consider what the person is feeling. And in the care space, it's a dangerous thing not to think about because if they're not happy and if they're burnt out, it's going to make that care unsafe for the client. So it behooves us to really all care for each other in this manner. So we send out satisfaction, a survey for our clients. Guess what? We send it out to our caregivers too. We want to hear your voices. We want to hear the things that are concerning to you. We have this regular checkup. We know things like, if they're not comfortable with the safety concerns, we encourage escalation almost immediately. And we have continuing education program now where we're coming back to talk about, it's one thing you graduate with the skill of being a caregiver, but the journey continues, the emotional intelligence to be at home, how to navigate different dynamics, family dynamics, how to you navigate even yours, how to call out your biases. I mean, this it demands a sort of maturity. For example, we have this core religion groups in Nigeria, Christians and Muslims, and believe it, that is entangled with a lot of biases. And we have the tribal groups, the Igbos and Yorubas and Hausa. That alone will carry on a whole lot of cultural biases that even them are not aware. So we try to have this continuing education practices so that not only are they aware for themselves, but also they can see it in clients and treat it with empathy and understand it's not a personal thing, it's just that. But then our nurses go back to the home on a monthly basis. And not only just to see the client, but also to see how the caregivers are operating. And another thing we've instituted in our program is a caregiver will only have a certain amount of time to work in a home with demand breaks for the psychological just recovery and all that stuff. Because of that domestic work culture, is not something that most people think about, like you have to stop and go away. So we try to again make sure that they're partners in care so that they could step away, recharge spiritually, mentally, physically, and all that stuff before they go back into the homes.
So, not only do you care for these home caregivers by giving them the skills they need to be successful in the workplace, but you also care for their emotional health and their longevity in the work that they do through making sure that they're well supported all around. One of the issues that comes up in the healthcare setting is quality assurance and quality improvement activities. And, these are regulated in hospitals, in clinics, and people are required to do certain actions to stay accredited as a healthcare organization or certified as a healthcare provider. And you, in your home caregiver program, have similar checks and balances. So you've implemented electronic health records. You've described that you have a lot of nursing oversight to make sure these individuals are effective and safe. So tell us a little bit about what sorts of quality metrics you collect and you track data on, and how you've used these quality data and metrics to go on to improve care.
In most systems, right, you know that innovation is tied to technology, right? In our own, innovation is tied to prevention, and precisely why we needed to launch that EMR system to make it a collaborative environment between the client, the caregiver, and the nurse who is not physically at home but continuous oversight. We do track 5 core metrics: preventable falls, preventable pressure injury, avoidable readmissions, preventable aspiration, especially if we're in a functional decline of the patient. And the reason why we do that is if we're tracking it, then we have to risk assess and risk mitigate. And that is where the EMR comes into place. So we've looked for evidence-based assessment tools to use for all of those things. And a lot of them are free and they're out there. So we've integrated them into our EMR so that our nurses can do that assessment, and then the risk will start to show up. And then once we are at high risk, then we can plug in our intervention. We also, like I mentioned before, we monitor our caregiver satisfaction and clients satisfaction. And in as much as it's about satisfaction, it's about synergy between them, the rapport. That matters in the home care because if we don't like each other, it's not that you're a bad person or you're a caregiver. It's just not going to work. And we've had instances where families are now, leaning towards one caregiver over the other one, and we have to figure those things out because it's like it's an interesting dynamic. But we do track those things and we monitor them and we report them out in our meetings. We had a recent fall, a stroke patient who fell, no injury was reported. But we immediately called a meeting as a group to learn about what exactly could we learn from that. And once somebody called us and said, this is Nigerian space where caregivers are calling us to let us know that someone fell. Let's actually celebrate that psychological safety because this is not a natural phenomenon where, in a society where there's a lot of hierarchical stuff and blame culture, they're calling to say this happened. And what we learned about that fall was it was a recent stroke with right hand dominant patient. Caregiver said, hey, are you okay? I'm going to step away. And the client said, I'm okay. And when we delved into the case, we recognized that even the patient is now aware of the limitation of that paralysis, that dominant side is no longer functioning. Like it takes a while to adjust to that thinking. So we can't rely on them saying, yes, I'm okay. They're reasoning based on their old self, not on, so even things that you won't learn in the textbook will show up. So we do actually call any event that we have, we report it out within ourselves. We don't have anybody or any regulatory body asking us to report it. But we know it works because it's all about improvement. It's not to be perfect. It's intentional. It's for us to learn and refine our systems.
Yeah, and you brought up a really important point in terms of, there's different environments with different cultures. In some environments, it's a high threat setting. People are afraid to speak up. And in some environments, you make it comfortable for people to speak up, and fostering that environment of psychological safety, the culture of safety, is really something that other programs can learn from your experience for sure. So, we conclude each episode of Mapping Healthcare by learning a little bit about the place our guest comes from. And you were originally from Enugu, which is a city and a state in Nigeria. So tell us a little bit about a couple of places or experiences in that area of Nigeria that a person unfamiliar with the area should check out.
First of all, yes, I'm from Enugu, Nigeria. I'm from Nsukka specifically. And I want to just take this opportunity to call out the jollof rice debate. I don't know if you've heard it. Uh,
In a previous episode, I interviewed Ilom Ochi from Ghana. We ended that episode with a little bit about the Jollof rice debate. But yes, go on. That is just something I'm continuing to learn about, and it's bigger than I imagined. So go on.
And I'm sure Ellen said there is Ghanaian jollof rice, but I'm here to correct that. It's the Nigerian jollof rice that is the best. And I know that there's even a YouTube thing that talks about one jollof, like we should come together and have one jollof. We refuse. We want to be one in other spaces, but not the jollof rice because Nigeria will need to just wear the crown. But coming back to Enugu, where I'm from, I'm from Nsukka. I was raised by my grandmother. It's not a city, it's a remote place. We are grounded in rhythm and pride and food and music and all of that and culture. But there's something that is so profound about my village. I want people to visit the hills of Obimo. You come into the village, you're really surrounded by these big mountains, green. And it's just so calming to be around, and it's a hike, it's a hiking experience, but it's just different. It's breathtaking. So every time I go home, I connect with it. So it's very special to me. But if that doesn't resonate with anyone, just please stick with the Nigerian jollof rice is the absolute best.
Yeah, that Jollof rice debate seems to be a common thread across interviewees right now. So, to demystify Nigerian Jollof a bit for people that might not have heard that episode on the Ghanaian Jollof previously, tell me a little bit about what are some of the ingredients that make Nigerian Jollof rice so special.
Well, I'm afraid that the Ghanaians will come and try to, take our recipe. No, the interesting part about this is our major component of the ingredients are really the same across the board, right? The rice, the tomatoes, right? The pepper, the onions, the salt and pepper, depending on what you use. I mean, these things are really generic across our board, but I think it comes in the style in which you cook it, right? Do you mix the sauce and the rice together? Do you cook it over the which kind of fire? What kind of rice do you use? And I think those are really the components. And I think it's a taste of culture, it's a taste of where you're from, is a nostalgic taste. Because we all grew up with jollof rice as a staple. So when we fight for it, we're really fighting for that nostalgic emotion that attaches to it.
Yeah, so it looks like there isn't any secret ingredient that makes it special, but maybe the secret is love, right? Because when you were describing this rice, I felt in your voice the amount of love and care that goes into preparing this for one's family. So maybe the secret of jollof rice is love, which then brings me to tie this into the theme of our episode, because Don Abedian, who is one of the fathers of quality improvement, is known to have said the secret of quality is love. And the work that you do through the caregiver training program really tells me about the passion and the love and the genuine care you have for your work, for your patients, for others, and for the caregivers that you train, which is really essential for achieving high quality healthcare.
Thank you so much for having me. Thank you for what you're doing, giving this platform for people to come and share their experiences. It goes maybe further than you can even imagine that it does. So thank you too for having me on your show.
Thank you, Chika. I really appreciate you saying that, and I appreciate you. So that was Chika Odioemene telling us about her experience with caring for home care workers in Nigeria. You heard about how interdependent care is in our society, whether you think you might need care in the future or you're currently caring for a loved one. Understanding this complex world is absolutely crucial. It really underscores that the quality of care that millions receive depend directly on the well-being, the recognition, and the support given to home care workers. Home care workers are an often unseen foundation of healthcare delivery. Yet at the same time, they face significant challenges. Valuing them, addressing their professional and personal needs, it directly leads to better outcomes for everyone involved, for the care recipient and for the caregivers themselves. There's no place like home when it comes to comfort, health, and healing. As the need for care in the home continues to grow with an aging global population, these workers pose a critical question for all of us. Can society truly afford to keep this world of home care invisible? And what will it really take for us collectively to fully see, to value, and provide the necessary support for those who perform this absolutely essential work? Thanks for tuning in. This was your host, Dr. Sheikh. You were listening to Mapping Healthcare on KDRT 95.7 FM. You can hear Mapping Healthcare around the world anytime on kdrt.org and wherever you get your podcasts.